Hi everyone, I'm Dr. Wendy O'Connor. Today we are talking about cognitive behavioral therapy. And this is the specific type of therapy that I practice every day. So we'll go over for a few minutes the basics of CBT. I'm sure a lot of you have heard about CBT at this point. It's a really popular, very well studied approach to therapy that is based in science. So we have really effective outcomes. Patients get better very quickly when they use CBT protocol. And today we're going to be talking about just some of the basics to introduce you to the concepts that we use. So, cognitive behavioral therapy is the practice of identifying our thoughts, our feelings, our behaviors, and how they all interlink. And I'll draw for you a quick model to give you a visual component to it. But the idea is that we want to identify three major aspects of what we're going through when we encounter a particular situation or life event that triggers us to feel a negative emotion. So, hopefully you all can see this. You see this? There we go. Kind of see it. Yellow is not the best choice of a marker. However, what you can see here, kind of, is our thought, our feeling, and our behavior. Let me go over that darker. The idea is that our thoughts, our feelings, and our behaviors are really quite linked. And if we can get in there and make some changes, both at the cognitive level, which is our thought process, and at the behavioral level, which is how we act in response to a trigger, that we actually have a lot of control over how we feel, and therefore have a lot of control over our success, our goal accomplishment, our feeling grounded, feeling stable, all of that. So it's a little bit easier to see now. But the idea is that our thoughts trigger our feelings, our emotions. Our emotions tend to then lead to some behavioral response. So I'll give an example of this. Let's say you are at work and you receive an email from your boss, and she says that she wants to schedule a meeting with you for tomorrow. And this would be the benign situation that comes up. So right now, all we know is that you have a meeting scheduled tomorrow with your boss. And if you give that example to 20 people, they might say, well, I might need to know more about it before I really can gauge how I'm going to feel. But for you, in this particular example, you say, oh no, why does she want to schedule a meeting with me? Did I do something wrong? Am I in trouble? Am I going to get fired? So all of a sudden the thoughts start rolling in. These these thoughts right here are our trigger thoughts. They're not just a benign reaction to a triggering event. They are the assessment, the meaning, the interpretation that we add to a situation. What our head tells us, what our thoughts tell us is true. So the thoughts start to chime in and they say, uh-oh, you're in trouble, you must have messed up, I bet you're gonna get fired. Which leads us to feel what? Worried, anxious, fearful, scared, anything in that category, right? We start to kind of freak out because our head tells us, ring the alarm, we're in trouble, something's not going well, and then we start to feel anxious. When we feel anxious, that emotion tends to lead to different behaviors over here than we would do, what we would engage in if we weren't feeling anxious. So if we received that email from our boss and our reaction was, oh, interesting, okay, I have a meeting with my boss tomorrow, I should put that on the calendar, and then you move on, your behaviors are going to be just the same. Go on with your day, go to your meetings, have your lunch, talk to your colleagues, nothing, no big deal, nothing changes. But if you start to tell yourself, I'm in trouble, which elicits the emotion of anxiety or fear, panic, that then leads to the behavioral response, which is different. Like you get out of your chair, out of your office, you start to pace your office. You rush over to your coworkers and say, what's going on? Do you know what the problem is? Did I do something? Did you do something? I got an email from our boss. What's the deal? You might skip lunch because now you're getting really upset and really anxious and you don't have hunger anymore. So we start to engage in these behaviors, and these behaviors are based on thoughts that our head is telling us are true, but we don't even know if they're actually true. And this starts a vicious cycle. So one of the points of intervention that we make in CBT is at the cognitive level. Because our thoughts are the ones that are a little bit tricky and tend to be distorted in situations like this, we intervene right at the cognitive level and say, hold on a second. Is the thought that I'm telling myself in this moment actually true? Is it based in evidence? And the way we figure that out is to maybe ask yourself, do I get emails like this from my boss a lot? Does she usually call me into her office to tell me that I did something wrong, or to reprimand me, or to threaten to fire me? What does the evidence in my history show? You might say, well, actually, I've had several meetings with my boss, and they've been fine. Actually, she gives me really positive feedback. I've only received positive reviews from my boss. So once we start to examine some of the evidence, we have an opportunity to restructure our thoughts. So we'll get to that in a minute. But the idea is that our thoughts, our feelings, our behaviors are really interlinked. And if we start to let our mind run away with us in a distorted way, then we tend to engage in behaviors that now perpetuate this vicious cycle. The other place that we intervene is the behavioral level, and we'll talk about that a little bit more too. But essentially, it's not just about what our head tells us, it's also about our behaviors. So those behaviors like jumping out of your chair and running over to your coworkers, or emailing your coworkers and saying, what's going on, we're in trouble, what's the deal? Now you've just engaged in behaviors that just reinforce the belief that something's wrong, but we don't actually know that something's wrong. So why are we engaging in behaviors that indicate that something is a problem if we don't yet know whether that's true? So I hope that diagram kind of helps illustrate just that link between thoughts, feelings, and behaviors. And this is really a huge part of the work that we do at CBT. There's a lot of homework in CBT. So if you've never done this type of therapy before, a few things for you to know are that it's collaborative work. So you come in and you work with your psychologist and you identify the triggers, and we talk about distortions, and we pick places for intervention within the thought level and the behavioral level. But most of the work that you're doing is outside of the session, because I'm only with you for 45 minutes a week, and most of your life is happening in between our sessions. So you are assigned homework by your therapist, and some types of homework that I tend to give are things like mood tracking. So I'll often encourage patients to track their mood for a week or two. Let's get a really nice snapshot of what's going on with your mood. What are the highs? What are the lows? How quickly does your mood shift or change? How severe are the emotions that you're feeling? So I ask you to rate your mood. I ask you to identify your trigger thoughts in certain situations. I ask you to identify distortions that your thoughts have. And what I mean by distortions those are really the errors in the way that we think. So there's a lot of common ways that our minds play tricks on us. And some of the more common cognitive distortions are things like fortune telling, where we actually think that we can tell what's going to happen in a situation without having evidence to show that's true. Or catastrophizing. We tend to buy into the worst case scenario because we have an anxious mind that tells us it's true without actually having evidence that supports it. So we identify cognitive distortions. We work on cognitive restructuring. But the behavioral piece is a really significant piece too. So we not only look at the behaviors that exacerbate your anxiety, like in this situation, instead of acting as if that belief, that negative fear-based belief that you're in trouble is true, and ringing the alarm and running around the office and skipping your lunch and getting yourself worked up, we talk about ways to resist the pull. We talk about ways to ground yourself instead. We talk about ways to let yourself opt out of the desire to ring the alarm and instead focus on calming your body, which helps calm your mind. So we talk about things like diaphragmatic breathing. We talk about meditation. We talk about focusing on your senses. We talk about slowing down. So if we think about this example, particularly with anxiety, we tend to get really worked up really quickly and we get really racy. We have racing thoughts, our behavior speeds up. So one of the things we talk about is how to slow everything down, how to slow down your mind, how to slow down your body, how to ground yourself so that you give yourself the best shot to think rationally and to act as if your rational thoughts are the truth-based thoughts. What else? Oh, the other behavioral component that we talk about is just generally speaking, what behaviors do we engage in throughout our daily life, not just in this particular example with our boss, but in our daily life that exacerbate anxiety, things like not prioritizing quality sleep, things like too much caffeine, things like overscheduling yourself. What are the behaviors you engage in that make your anxiety worse? And what are the behaviors you could engage in that could allow you to feel less anxious or to alleviate anxiety altogether? Things like adequate sleep, nutrition, regular exercise, slowing down, choosing very mindfully not to overschedule yourself, being aware of what your triggers are, and choosing to maybe minimize your exposure to those things on the days that you have control over it. So, in summary, the basics of CBT are connecting our thoughts, our behaviors, our feelings. It's about stopping that vicious cycle before it runs away with us. It's about identifying the distortions in our negative thinking and replacing those thoughts with grounded, truth-based reality thoughts. These are all things that you can do with a psychologist on your team, and it's a very collaborative effort. We talk about behavioral components, so minimizing the activities or behaviors that exacerbate your stress or anxiety, and maximizing those activities that really ground you and help you feel solid and stable. So I have some handouts I can email you if anyone's interested. Feel free to send me an email, and I can send you the model, the cognitive behavioral model that I drew for you. I can send you a list of some of the more common distortions that we tend to have in our thinking. Feel free to just reach out anytime. But psychologists who are trained in cognitive behavioral therapy are at the ready and willing to help you feel better as quickly as possible. So I encourage you to reach out if any of this resonates with you. Here is my email, as always. Here is my website, if you want to check out what I do in particular. And if you want to give me a call and schedule an appointment, feel free to use that phone number. So I hope you all have a great day. Thanks for tuning in today. I hope you learned a lot. And I wish you all the best. Have a great day.